Okay, good morning, everybody, and welcome. We're glad that you can join us this morning. We appreciate Karen inviting us to come and speak with all of you, and we hope that the information that we share with you today over the next hour or so will be valuable as well as helpful to all of you with your clinical trials. So I'm not sure how many people may have been in the middle of a clinical trial during all of this COVID that started, but this information that we're going to be sharing with you is mainly for those of you that are either in the midst of a clinical trial or have already started something and then it had to stop. But again, these are strategies and tools that can be used before, during, and after your recruitment. So as Karen mentioned, my name is Mary Becker. I am the program coordinator here for Recruitment and Retention at the Center for Clinical and Translational Science. And as Karen also said, we will be discussing strategies and tools for recruitment and retention. So Karen, if you want to go ahead and advance the slide for me, please. Thank you. So as we ease our way into this, let's start by saying that there is a collective recognition that recruitment is a key factor of success for research. So that is to say, without participants, there may be no clinical trials. Next screen, please. Thank you. This is my favorite screen. So many researchers here at Ohio State and around the country are finding themselves asking what they can do during this time. So we're all facing changes and challenges as to how we operate daily and on studies, because studies are either being shut down or modified or put on hold. So I'd like to begin by mentioning that a little factoid that I found as I was doing some research that mentioned that over a period of 2 days in March of this year, 170 clinical sites in the United States were surveyed, and it was found that 39% of them believe patients will be less likely to enroll in new trials during this COVID-19 pandemic. That's an alarming number when you stop to think about it, that this could be a part of our, quote, new normal. So today we hope to discuss what teams can do during this time to help continue their research for the future. So recruitment and retention. So one important step that can be focused on in recruitment and retention is both for current and future studies so that you can be prepared for when research fully resumes. So again, let's embrace our new normal, and we're going to be presenting via Zoom, and we'll see where that takes us. So retention of current participants, again, as Karen mentioned, that's one of the key ideas that we have to think about in clinical trials. So one of the things that we're going to discuss is having a communication plan. So with non-essential research paused on campus, it's important to think about your participation retention. And a lot of times we have found that this is one of those forgotten things that people tend to not think about as they're starting their studies, and we encourage people to make recruitment and retention foremost in their minds as they're getting ready to even start and plan for these studies. So to begin, you'll need to develop a communication plan and think about how your team can foster relationships and added value. It's important to communicate with current participants about the study being paused. And again, this is focusing on the current situations right now. So by this, I mean include information on things such as what the process will look like, what will happen with their collected data to date, and how the research will move forward in the future. So, for example, will you be in touch periodically via email with them? Will you be making phone calls to give them updates? What are your plans to move forward when the all clear has been given? So, as always, it's important to think about health literacy when you're communicating with folks. So make sure that your communications are in an easy to understand language. So maybe come up with some scripting to use for your message, one that's consistent with all participants. You can also think about the possibility of creating a fax page to include in your communications if you're using email to update volunteers and participants. Or you might be reaching out at certain intervals to give your participants or your volunteers updates on the status of the study. So it's important to stay connected with your participants throughout the length of the modified operations. We want to keep participants updated of the current study status. For example, if your study is on hold indefinitely, and say it will resume in August. So you'll want to check in and see how they're doing. So keeping in touch with regards to personal milestones of your participants with thank you notes. You can do it with birthday cards, or you can get creative and come up with some ideas of your own. But the goal is to keep your participants engaged and feeling appreciated. So with any research study, it's important to consider the benefits to the participant, and during a downtime, it's no different. So consider sharing information that could be helpful for them. For example, you can share the OSU's COVID-19 resource page that's found on the Wexner Medical site. And I will say that throughout this presentation, we might refer to some websites. We will, at the end, be putting a slide up with that information. And again, Karen mentioned that we will send out a slide deck of this. So if you do have questions or you want to refer to something, it should be there as well. So let's see. Next, there we go, business as usual. So with site closures and travel limitations and quarantine, they're having an enormous impact on conducting clinical trials during the COVID pandemic. So the FDA has released new guidance on conducting clinical trials during the crisis, and their guidance aims to ensure the safety of all trial participants while minimizing the risk to trial integrity. So they have urged companies and participants to keep moving forward with studies where possible. So one of their key recommendations is to use virtual site visits, um, phone interviews, or even apps on smartphones. I'm not sure if anybody has tried any of those options yet, but again, it could be our new normal. So not obviously all of these studies are going to lend themselves to these options. So try to think of other ways that will work for you and for your study. So during these modified operations, you might be able to continue with altered activities like moving to remote data collection by video chat, or maybe the study can continue without change because it was already utilizing remote contact. If the study is continuing in some way, then again, retention is still an important consideration. So virtual studies, again, not sure how many of you have done this, but there are some pros to this. So keep in mind a few of those as you move forward. So there's an opportunity with virtual studies to collect information in real time. And they are actually more cost effective because while they still require a site for the trial staff, they don't require multiple study sites. So again, they're more convenient. There's no travel time involved, no associated costs with the travel, such as parking fees, gas, etc. And those sites, or I'm sorry, those virtual studies can be easily scheduled. So people can just hop on whenever they have a quick second and do whatever they need to do for your study. And they also increase the diversity of participants, opening up these trials to people with mobility issues, the elderly patients, and people who live in rural areas. So there are pros to doing virtual studies. So communication. It's a big word that we have in research studies. So it's important to inform the participants if the study will be continuing. You'll want to discuss with them how it will be continuing, any changes they can expect, such as these face-to-face visits may now be replaced by virtual study engagements. And you have to understand and explain to them why this is happening, why you can't be face-to-face. Hopefully everybody understands that at this point, but again, you need to be transparent with this. So discuss with them how the study will continue, any changes. You will want to ensure that the participants have the current contact information for the study team, which is very important right now, especially during these times that not only are things changing day by day, but sometimes hour by hour. So it's difficult sometimes to keep up with everything. So just make sure that you're touching base with them and sharing your contact information. And additionally, continue to keep in touch with them, keeping them updated, obviously, and foster that relationship with them. So again, you might want to send out reminders that they have an upcoming virtual session with you. You can reach out by text. You can send a postcard, which isn't as timely, but if you have that time, again, consider all these options as just ways of staying in touch with them. So teleconsenting. Um, with remote participant contact, there probably will need to be alternative consent options, such as telephone and electronic consent. So when considering consent options, think about the entire process. So how will the information be provided to the participants? And how and when will questions be answered? And how will consent be captured? So if you are part of a study team, you will want to visit the IRB policy page on consent forms. Next screen, thank you. So planning for future recruitment. During the time of these modified operations, this time can be utilized to think ahead on your recruitment plans and methods and materials for studies that have been paused temporarily or studies that are not even yet open to enrollment. So action plans during this time can include things such as expanding your recruitment methods. So an example would be you might decide to put out a flyer, or you might decide to send out postcards trying to get some participants. Or you might consider, if you haven't already done so, to list your study on our study search site. So again, some more options would be include updating your protocols, creating and updating recruitment or other study materials like I had just suggested. You might want to explore some new tools. So in recruitment and retention, we have rolled out a joint project with MyChart for recruitment, and also one of the big methods now is targeted social media. Both of those, which Tiffany will discuss shortly here. You might want to include some new partnerships and also updating current websites, such as your lab pages, your study search site, as I had mentioned. So make sure that all your staff is communicating with potential participants that have already received proper training. So again, during this time, we are available in recruitment and retention. We're available for Zoom consults. If you have further questions about any of our options on planning for future recruitment, again, we like it to do it before you start your study, but again, we can hop in at any time. So we are also available by email. Just look us up, tiffany.bernard@osumc.edu, and myself, mary.becker@osumc.edu. So expanding recruitment methods. And again, I talked a little bit about this on the previous slides, but you will want to think about how to expand your recruitment on current studies or what studies you may have opening soon. So for example, update your database of participants and think about exploring new ways of recruiting. So one method that we have seen take off most recently is the use of social media, namely Facebook. And because you tend to be able to create a profile of a target audience, Facebook seems to be very helpful in reaching your enrollment numbers. So again, this is something Tiffany will touch upon shortly. Updating your protocols, we just mentioned. So you'll want to do that with the IRB to include updates to your recruitment and retention plan or anything new or updated materials that you have added. So if you decide to try something new now for options, just make sure that you are updating that in your protocol. So recruitment and study materials. So for example, make sure that your flyers are meeting health literacy guidelines. Update your information so that it's engaging if needed. So you might want to use some new graphics. We have found that showing actual faces on your graphics has proven to be a much better method of getting folks to pay attention rather than just having some content and written words on flyers or postcards. So, and make sure that you are using best practices, of course. So the more methods that you use, the more opportunity you will have to reach your intended audience and thereby meeting your participant goal numbers. Again, exploring newer tools. So take the time to learn about new recruitment tools now. As I mentioned, we are available for consults. This can benefit you with your current studies or future studies. We will discuss some of the tools that the CCTS offers that may be helpful, such as My Chart for Recruitment, if you qualify to use that, as well as the targeted social media. And think about beginning new partnerships. So now, during this downtime, is a good time to think about how to reach out to potential collaborators and community partners about future recruitment. The CCTS has a community engagement core that's available to help share ideas and help make connections with community partners, advisory boards, and other community reps. So again, feel free to reach out to Recruitment and Retention, and if necessary, we can go ahead and share names and with some of our coworkers that are in community engagement. Hopefully it would be a good match for you. And again, updating your current study websites. Use this time to check that the information is up to date, the correct contact person is listed, and any other things that you might need to perform site cleanup. And like I had mentioned before, just think about what can be done for recruitment now in order to ensure that you are ready when research fully resumes. So again, think about how to make it a positive experience for your participants so that they will want to share, and try matching your recruitment tools to your target audience. And again, that's what we're here for, to kind of guide you along. And this last screen, these are some of the additional resources that we would suggest that you visit. They are some facts pages on here. Probably a lot of you have already gone to these websites. And again, we will include this in our slide deck, so don't worry about trying to catch this on your screen right now. It will be available. As I said, we are also available for consults. So if you hear anything that you have been interested in during this presentation, which I hope you have, again, feel free to give us a call or shoot us an email and we can set something up using Zoom. So at this point, I'm going to turn it over to Tiffany, and she is going to talk about some of the recruitment services that are actually offered by the Center for Clinical and Translational Science. Tiffany?